Thank you, Chairman. Ladies and gentlemen, it is my great pleasure to be here today representing the Health and Food Safety Directorate General of the European Commission, and I thank you for your kind invitation. As we know very well, the COVID-19 pandemic has triggered an unprecedented global health crisis. Non-communicable diseases were already a considerable challenge priority prior to the pandemic, and COVID-19 has exacerbated it. The fact that too many of us suffer from non-communicable diseases has rendered our societies more vulnerable to the sudden appearance of the virus. And that was evident also for people with obesity. In addition, as a result of the pandemic, many EU countries face an increase in already high rates of overweight and obesity among both adults and children. We know that the almost exclusive focus of our health systems on COVID-19 since 2020 had relevant consequences outside the remit of infectious diseases. Diagnosis and treatment of non-communicable diseases was forcibly postponed. Health prevention and promotion activities have been put on hold. Even physical activity was reduced tremendously during lockdown periods. The lessons learned from the COVID-19 pandemic force us to reevaluate our existing framework of action at the EU level. And we need to take this opportunity to put long-term solutions in place. The Commission puts high importance on fighting overweight and obesity and improving nutrition, since they remain some of the major health determinants of non-communicable diseases, including cancer. Healthy and active lifestyles, including proper nutrition and regular physical activity, are the main drivers which contribute to maintaining a good health. Previously, to help the EU countries combat the increased overweight and obesity rates, the Commission launched in 2020 the Best Remap Joint Action with a €6 million budget to implement best practices in the area of nutrition, which includes initiatives focusing on food reformulation, reducing aggressive marketing to children of food high in fats, salt, and sugar, and on public procurement of food in public institutions. Now, a key priority of the Commission in regards to fighting obesity in Europe is to take forward the Europe's Beating Cancer Plan with a budget of €1.5 billion. Obesity not only carries its own challenges, but also adds to the risk of cancer and other non-communicable diseases. Europe's Beating Cancer Plan is a major effort of the Commission to address with renewed drive all aspects related to the challenges of cancer in Europe. Europe's Beating Cancer Plan also includes action to promote better nutrition as a contribution to reducing cancer incidence related to poor diet and lack of physical activity. Importantly, under the Farm to Fork strategy, the Commission prepares a number of initiatives to promote healthy diets, reduce aggressive marketing of unhealthy products, high in fat, sugar, and salt, stimulate the reformulation of processed food products, and improve information to consumers. As part of this strategy, the Commission has committed to prepare a proposal for a legislative framework on sustainable food systems by the end of 2023. The ambition of this strategy is to help facilitate a shift towards a healthier and more sustainable diets across all generations, and create a fair, healthy, environmental-friendly food system where the healthy choice is the easiest one. The Commission furthermore advocates an integrated approach to addressing these problems by involving local, regional, national, and European stakeholders to reduce the risk associated with poor nutrition and insufficient physical activity. The new EU4Health program, which runs from 2021 to 2027, is key for improving the health of the EU citizens. The program, with a 5.3 billion euros budget over 7 years, is already proving to be a game changer. And at least 20% of its budget is allocated to the health promotion disease prevention objective, including cancer. In this context, the Commission has launched on 15 December 2021 the Healthier Together EU Non-Communicable Diseases Initiative to help the EU countries to reduce the burden of non-communicable diseases, which account for the 87% of the health burden. The initiative of Healthier Together covers cardiovascular diseases, diabetes, chronic respiratory diseases, mental health and neurological disorders, with an important horizontal strand on health determinants in coordination with Europe's Beating Cancer Plan. The action on fighting obesity fits all of these strands, but in particular the one on health determinants. The text of this initiative is being drawn up in an innovative participatory process with EU countries and stakeholders and input from international organizations, namely the World Health Organization and the OECD. We have also opened a broad conversation with stakeholders via the Health Policy Platform. We have now around 200 active participants from the NGOs, patients' organizations, academia, health professionals, but also industry players. Through this process, we will produce a practical toolkit of actions and tools by 22nd of June 2022, when, at an event chaired by Commissioner Kyriakides, we will present the final document of the Healthier Together initiative. The initiative will create a structured framework to guide and coordinate action, and in parallel, it will identify those actions to be implemented on the ground. Already this year, just to give you an example, under the EU4Health, 2 joint actions with the EU countries are planned. One, with a budget of 53 million euros, will address cardiovascular diseases and diabetes. The other, with a budget of 75 million euros, will address health determinants, including fighting obesity. Calls for proposals on the same subjects targeting NGOs, academia, civil society organizations are also planned for a total of 16 million euros and will be launched in the summer this year. In concluding my speech, let me reassure you that we remain fully committed to supporting EU countries in achieving the United Nations Sustainable Development Goals and the World Health Organization targets on non-communicable diseases, including fighting obesity. Thank you.